Hi guys, welcome back. In this video, I'm going to share my experience getting my peritoneal catheter and stent removed after 3 weeks having my kidney transplant. I was on peritoneal dialysis for almost a year, and thanks to my amazing brother, 4 months ago, I was the lucky recipient of a kidney. I was supposed to have my catheter removed during my surgery, but there was some doubt about if my kidney was working or not. They knew I was producing urine, but they didn't really know if it was my new kidney or my native kidneys, which still had about 4% functioning. So to not risk it, they decided to just leave it in place. 3 weeks after my transplant, when I was finally starting to feel myself, I was scheduled to have it removed, and I really wanted to get it removed, but I was also enjoying starting to feel good and just back to normal after having a major surgery, but I was also excited to get it out. This second surgery seemed to be the perfect time to also have my stent removed. A stent is a tube that is placed in the ureter that helps to have proper urine drainage from the kidney to the bladder. And this is only necessary until the connections between the transplanted ureter and the bladder heal. They usually removed the stent with anesthesia 4 to 8 weeks post-transplant. For me, I was already having a surgery, so it kind of makes sense to do it then. The surgery to remove my catheter was an outpatient surgery, meaning there is no hospital stay. To remove the catheter, they usually do 2 incisions, one besides the catheter exit, and that is to remove the cuffs that holds the catheter in place so it doesn't move in and out, if that makes sense. The other incision is right where the catheter exit is, and that is to make it look like just a single line, because other than that it will look like a belly button. At least that's how my surgeon explained it. I'm sure she did a better job than I'm doing right now. So I hope it makes sense. Of course, every surgeon does it differently. My surgeon, I believe, did either 1 incision altogether or 2 right beside each other, because I end up with 1 scar. To remove my stent, they had to introduce a small camera through my urethra, find the stent, and pretty much just pull it out. Thankfully, I was under anesthesia and I did not feel any of this, but that's how they do it, and they do it actually without anesthesia most of the time. The surgery took about 30 minutes or less. It's really a fast surgery. Both my catheter and my stent came out. The worst part about this surgery was my time in the recovery room. When I woke up, I was in a lot of pain, more so than when I woke up from my kidney transplant. I am out. Took my catheter and it feels so good. I don't have something attached to my stomach anymore. When I woke up, I was in a lot of pain, even more than when I had my kidney transplant. It's getting better, and now I have to ride an hour to go home, and I just know that's going to be a little tough, but I'm ready to be home. I just got home a few minutes ago, and as expected, the ride home was very painful. I came home, got in the bathroom, and I went and looked at myself in the mirror to see myself with that catheter. And I think it's just a mixture of feeling a lot of pain to seeing myself without a catheter. I just lost it. Seeing myself without it, it means so much. It's a small victory. I'm not sad, I'm happy. It's very emotional. Sorry. But I am still in a lot of pain, and I just gonna sit here and relax, I guess, and hopefully I feel better. They didn't give me any oxycodone or any of those strong meds for pain. So I'm gonna take some Tylenol and just try to relax. For a few days, I felt a burning sensation when I peed. This is very common after having a stent removed. For me, it only lasted for about 3 days, and I didn't feel anything after that. The recovery from my catheter surgery was pretty fast, despite having so much pain the first day. The second day I actually got up like nothing. I didn't feel much pain, some sort of soreness and stuff, but I didn't really feel the need of taking any strong pain meds. Took Tylenol from time to time, and that was more than enough. As you can see earlier from the clips I recorded that day, seeing myself without the catheter was and it has been very meaningful to me. I fought a battle for almost a year, and that was without a doubt a victory. I love seeing my scar. It makes me very happy. It reminds me of a period in my life where I was very brave and very strong, and that makes me feel very proud of myself. I feel like having a chronic illness requires a lot of strength and a lot of courage. I believe that just recognizing that it takes a lot to live this life is worth thinking about it every day and give ourselves more credit. Well guys, that was my experience getting my peritoneal catheter and stent removed. I hope this video was helpful to you in some kind of way. If you are having catheter removed, that means you probably don't need it anymore, and that's amazing news. Or you're probably going to try a different dialysis modality. Either way, I wish you the very best in whatever is next for you. Take care, stay strong, stay healthy, and I'll see you guys in my next video.